is someone I hold dear to my heart. He was my work mentor. I miss him dearly in the office, just having fun and great conversations and really melting together. He is no other than Dr. Jeff Cohn. Dr. Cohn, I am so happy to have you here. I haven't seen you in ages.
I know. I am excited to see you. And first, I love your hair.
Thank
That's
you.
different from when I have last seen you. That shows you it's been a while, I guess. And anyway, I always love talking with you about anything, and so happy to be here tonight.
Excellent, excellent. So tonight we're going to talk about let's face our fears about cancer. I think that it seems like that is everyone is affected some way, some shape or form with cancer, be it friends, family, themselves. I mean, my dad just went through cancer treatment. He had prostate cancer. I know someone who was just diagnosed with cancer. So it is just like, oh my gosh, so many people. Every time I turn around, there's cancer. I just want to shout out my niece, Sharita. And guess who's here? He calls himself Riddy now. That is my son, Tehran.
Oh my, hey Tehran.
Yeah, so I just felt really passionate about talking about this topic. It's such an unknown and a great fear of when you hear cancer. If you hear it, even in regular conversation, it's like, oh no. So I really wanted someone that I knew that knew and was professionally um, equipped to really talk about this conversation. And you being a very experienced oncologist, who else could I possibly get but my buddy, Dr. Cole? So, Dr. Cole, tell the people about you. I know you've retired from actually treating patients, but you've done so much more. You've done so much in the community serving patients. So you have a wealth of information. But go ahead, talk about yourself.
So I started my career as an oncologist taking care of cancer patients. Oncologist is the name of the specialty that takes care of cancer patients medically. Um, there's also surgical oncologists, surgeons that operate for cancer, and radiation oncologists. But I was a medical oncologist. And if you'd like, later on, I can tell the story of like how I got into that field because
Later on, you can do it now.
um, well, okay. So I was a fourth year medical student. I wasn't sure what I was going to choose as like my career pathway. I knew I was going to be a doctor, but I didn't know what field of medicine I was going to go in. And I one by one I was ruling things out. I knew I didn't want to be a surgeon. Didn't want me anywhere near you with a scalpel. Um, I thought when I applied to med school that I was going to be a psychiatrist, but I got that out of my system pretty quickly. So I got a patient on my service like the first day of a rotation on a
Mm,
medicine rotation. So it could be any kind of patient in the hospital for a medical condition. And she was an 80-year-old woman who reminded me very much of my grandmother. She was about the same
mm,
age of my grandmother. She had the same hairdo as my grandmother. She had the same kind of spunk and sense of humor that
mm.
my grandmother had,
Right.
except she was yellow. And the
Mm,
reason she was yellow, it turned out, was that she had what was then, and it's still the case, a pretty serious, difficult to treat form of cancer. She had cancer of the pancreas, and
mm,
it had already spread to much of the liver, and it was blocking off the flow of bile out of her liver, and that's why she was yellow, because it was
Mm-hmm.
building up in her bloodstream. And so I was the medical student on her case. We did the tests to discover the problem and diagnose it. And then, because of her age and how sick she had already gotten, the decision was made that there is no treatment that
Right.
could be offered for her. So, and at that point, she was a week or even 2 weeks into the hospital stay, and she had already gotten a lot sicker, wasn't
Mm.
eating very much, and difficult getting out of bed for anything. So my role really was to provide updates to the family every day. And even though she was on the medical service of kind of a famous physician,
Mm-hmm.
the family would reach out to me whenever they got to the hospital just to find out what's going on with mom. So we got pretty close. She continued to get worse and wound up like getting confused and sleeping most of the day. In her confusion, she was like thrashing around one day, and she wound up banging her arm against the bed rail and fractured her arm. We had to treat her pain and put her in a cast. Anyway, um, one day the family, just in conversation, says to me, our dad is 2 rooms away from our mom, and he's dying of kidney failure and advanced emphysema. And tomorrow is their 60th wedding anniversary.
Mm.
So I said, "Oh my goodness, um, we have to do something." Even
Right.
though at that point he was practically sleeping the whole time, like in a coma, just like she was. I said, "We got to get them in the same room to
Mm.
be with each other on this day." And so I spoke to the nurses, and we wound up on the anniversary getting her in a wheelchair and wheeling her into her husband's room. And for about 5 or 10 minutes, they both woke up
Oh.
and were with each other, and then, and saying how much they loved each other. And then one kind of petered out and the other petered out. And that was that was it. She went back to her room. One of them died the next day. The other
Mm.
died a day or two after that.
Wow.
So 2 weeks later, I get a package in the mail at my house, and I open it. It's from the family. It's a sweater that they had bought their dad that they never got a chance to give him, but they were giving it to me out of gratitude for, everything that I did, which to me, I felt like I didn't do much of anything. There wasn't
Mm-hmm.
much to do, and they also said, and here's our address in Hawaii. Um, if you ever come to Hawaii, please look us up. We'd love to have you visit, which I have never been to Hawaii, and I don't have their address anymore. But anyway, I thought to myself, all right, here's a case that most of my classmates would have said, ugh, what a terrible case. She comes in, she's got an untreatable cancer, and a few
Right.
weeks later, she dies. And yet I felt like I was able to be helpful to the point where a family expressed their gratitude like this. So that's what made me want to go into oncology.
Wow, that sounds so very touching and actually fitting for your personality, for what I know of you, to really bring them two together and just have those moments to celebrate their anniversary. That is, I could see how that would be powerful and an experience that would lead you into the profession that you took. So, when we think about cancer, just general, I know it's all types of cancer, but what is cancer just from the basics?
So, first, starting um, with the basics, but talking about normal, we're made up of cells. Like we we think of, the different parts of our body. Those are like the visible organs and structures in our body. Each of them are made up of tiny microscopic um,
Mm,
units that are called cells. And um, and there are different kinds of cells. There are bone cells and muscle cells and nerve cells and heart cells and intestine cells, etc. So these cells, when we started out in our mother's uterus, we were one cell in the
mm,
beginning.
okay.
And as an complete organism, I think we've got over a trillion cells, some huge
Okay.
number. And they got to that number by dividing. Cells do that, first to form an organism, and then as part of like daily, monthly, yearly upkeep, maintenance, growth, they have to continue to be produced in order to replace cells that have died,
Mhm,
or
mhm.
if you cut yourself, new cells need to grow to heal the skin up, stuff like that. So in order for cells to divide, they need to be like identical, right? The
Mm,
cell that is going from one to two, it should be a twin of the same kind of cell that is being
right.
produced. In order for that to happen, everything that's in the cell number one needs to be like Xeroxed, um,
A
complete,
carbon
a
copy, but
carbon
exact.
copy.
Yeah.
Exactly. And most of the time that happens, but sometimes it doesn't. And so the copy has something different than
Mm,
the first one because
okay.
everything didn't line up exactly right just by
Mhm.
chance. And there are other things, and we can get into this, that increase the likelihood that those chance uh, situations happen more often,
Okay.
like smoking or taking certain medications, being exposed to radiation. There are things that increase our likelihood that something doesn't line up properly. And so when you get a cell that things didn't line up properly, we call that a mutation.
Okay.
Most mutations lead to cells that don't work and they aren't capable of surviving. And so they just die, and you never know that it happened. But some mutations give the copy some sort of like an advantage
Mhm.
where it can grow more rapidly or it can grow in weird ways. And those are where cancers come from.
Okay. So it's basically a change within the cell that causes it to mutate, grow, and just change what its normal function is. And then
Exactly.
does it? Then it starts to affect other cells around it.
Well, it has the ability to grow and divide. And so it
Oh,
starts as a single cancer cell, and then it becomes two, and so on and so on.
oh, so that's what they mean by spread. Okay.
Well, and even growth. In order to detect a cancer, like on an X-ray or on a physical exam, it's already about 1 billion cells. That's how much there are for us to have the faintest inkling that there's a problem. Uh,
Wow.
until until that point, maybe with some blood tests we can detect it sooner than that, but using imaging studies or physical exam, um, it takes that many. So that means, for the most part, it's been around for a while, even though, it's been totally silent.
Mm, good
And
golly molly.
and the other thing about cancer cells compared to normal cells, or another thing, is that they don't follow the rules that normal cells do. Like normal
Mhm.
cells, once it bumps up against another cell, it like stops. Cancer cell typically won't. It'll like invade or push
Mm.
aside a
Oh,
normal
okay.
cell. And normal cells know where they live and they stay there. So, like an intestinal cell stays in the intestine.
Mhm.
But an intestinal cancer cell can get into the bloodstream, because it has the ability to invade into the lining of the intestine to where a blood vessel is, and then get into the bloodstream and travel to wherever the blood system takes it, and then put down
Mhm.
roots in other parts of the body and grow there. It doesn't care that it's not in the intestine anymore. That's the spread of cancer. That's how that happens.
Wow, I know it probably isn't quite the same, but what I thought about that, how it reacts is almost like a weed in a garden,
Hmm.
how it just invades and destroys your plants and it starts to spread all through your garden if you don't get it really quickly. But even the way you just described, even if we find it out early, it's still a lot. Like you said, 1 million. Like I would have never imagined that it would be that type of increase just to notice it. It's
Yep.
almost don't sound like it's early.
Right. No, that's the truth. And from that standpoint, it's kind of amazing that we have the ability to cure so many cancers, even
Mhm.
though there's so many cancer cells in the body already.
Right, right. And it's funny that you mentioned with how you got connected with pancreatic cancer, because that's what my brother had. The first time he had it was about, well, I guess it would be 7 years now. But he kind of beat the odds by lasting 6 years when they were really telling us in the beginning 2 to 3 years. And they couldn't even remove all of the cancer. He because his cancer grew like you was explaining and pushed up against his aorta, and it was just a speck still there, but that they felt like that increased the odds of it returning more aggressive and quicker. But he ended up living 6 years, in fact, which I know is pretty unheard of. It's not the norm in no way, shape, or form.
For sure. Yeah, I had an uncle who had stomach cancer. And I remember my dad, who was a surgeon, coming back from the operating room. He didn't
Hmm.
operate on him, but he was in the operating room just watching. He got permission to do that. And um, and he had gone to one of the best hospitals in the world, the Mayo Clinic, to
Mm,
get his surgery. And they took the tumor out entirely in the stomach. And just like with your brother, there was a single spot that they found somewhere else in the abdomen. The abdomen's like a big cavity, a big
hmm
space where all the
hmm
organs are. So they found one other place and they took that out too. But when my dad was telling me about it, I was a third year medical student at the time. He he was saying, that means kind of the horse is out of the barn.
Hmm.
If it was in this one place outside of where it started, what's the likelihood that that's the only place that it is? And it turned out that within 6 or 9 months, his abdomen was just like full of cancer. It
Wow.
was, yeah, it was a shame. And it was totally invisible to the surgeon other than that one other spot
Hmm.
that they had removed.
Yeah, because even with my brother, when you were saying about your patient being yellow, my brother just so happened it was just like how things worked out. He was involved in a hit and run. He was a pedestrian. They put him on medication. He started becoming constipated, so he went in to see the doctor, and the doctor noticed some yellowing in his eyes and sent him straight down to the emergency room, and that's how we ended up finding out that he had cancer. Other than that, who knows? We probably would have found out way too late because he wasn't, of course, having any kind of symptoms other than constipation. And I don't think that's one of the symptoms, but I.
No, no, you're bringing up an excellent point, and a lot of people just have a hard time imagining how there can be so much cancer in a person's body and them not being aware of it. And
Hmm.
the unfortunate truth is that unless it's growing someplace like close to the surface or on the skin where it's visible, or easily felt,
Hmm.
or it's growing in a place that it winds up pressing on something important,
Hmm.
um, quickly, um, which can cause pain or can cause whatever it's pressing on, whatever the symptoms of that being blocked off are. Um, Cancers can grow for a long time, often even a couple of years, we think, from the beginning to when it winds up actually producing symptoms. So, over the course of that time, at least having a few of the cells learn how to get into the bloodstream and travel someplace else, that becomes more and more likely.
Yeah, it's just it kind of makes a little more sense how you explained how early and how much it is, even at the earliest notice of how many cancer cells are actually in your body, of how sometimes when you hear about someone who has cancer, it moves, it seems for some people it goes so quickly that the next thing you know that they're gone. And like I've heard of friends and other family members of friends who've had cancer, and it really has um moved that quickly where it's like only a couple of weeks and boom.
Right. Well, so part of that is like the tip of the iceberg phenomenon,
Mhm.
that, the part that originally causes it to be diagnosed, which usually, but not always, is where it started. Um,
Mhm.
that can be viewed like the tip of the iceberg, that underneath is all those other cells that have been growing and growing and potentially getting into the bloodstream and traveling. And so that's part of how this happens. And um, you know, your question reminded me, as did my story about my uncle, of something that a lot of people kind of think might be truth, but it's actually a common myth, which
Mhm.
is that when cancers are exposed to air, that triggers it spreading. So certain patients who have cancer for whom an operation could be useful, maybe even curative, may be concerned about having surgery because of this fear that no,
Right.
if you open me up, it's the air's going to hit it, and so you know my uncle's case maybe could be viewed as, well, that's exactly what happened. Look, they removed it all, and 6 months later it was everywhere in there.
Hmm.
But the truth is, just knowing the biology, it was there at the time that they operated, and they knew that because it was already visibly there in
Right.
one other place. And we know that wherever else it might have been, it was just too few cells in one spot to be able to be seen. It still could have been literally 100 million cells in one location. It's still not enough for us to be able to detect it. It's got to be a billion cells or more for us to be able to.
Jesus.
Yeah. So, that's just how it works.
Yeah, that is just so mind blowing, and in it, and also the how aggressive they are with moving and shifting, and mutating and getting in your blood system, and sometimes I would imagine you might not even know that it's in your is it the doctor might not know that it moved to your blood system until it appears somewhere else. Correct?
That's right. Um, yeah, that's why after, um, hang on one second, I'm
Mm-hmm.
just drawing a little chart. Um, so, um, that's why for most cancers that are being treated with cure as the goal, it's
Mm-hmm.
recommended that for some period of time, um, patients get seen by their oncologist or their surgeon just to monitor for any signs of recurrence, um, because patients may not have symptoms, but things might be starting to brew up. And sometimes you do x-rays or scans to monitor that. Sometimes, like for your dad with prostate cancer, there's a blood test that
Right.
is
Yeah.
even more sensitive way. So I wanted to just show one thing. I don't know if this is going to project well. Probably not. Okay.
Oh,
Well,
it's right there. Uh-huh.
okay. All right. So this is here a scale. This line, the line here
Mhm.
is a billion, supposed to represent a billion cells. So anything above the line is visible. Anything below the line is too few to be able to detect. Okay.
Mhm.
So the X over here, that might be, all right, we found the cancer and we operate on it and we treat it. And over a course of time, it seems to disappear or it's entirely removed. Okay, so you call that being in a remission.
Okay.
But what you have to recognize is that some remissions are like this X, that they're
Mm.
just below the ability to
To
detect
detect
it.
it.
And um, and so for that person, a few months later, this could be back up above the line, and that's a recurrence. For others, it's like this X, where it actually did take away everything that was ever going to be a problem. And so that's the cure.
Okay.
So, but both of them, for at least some period of time, the patient has no evidence of cancer.
Mm. And you wouldn't even know it's there.
You wouldn't.
Good
There
gosh.
there are certain things that can help increase your knowledge that it's likely that the cancer is going to recur. Sometimes the size of the tumor, for certain types of cancer, you look at the lymph nodes, though that's part of our immune system, that
Mhm.
are scattered throughout our body, and many organs have lymph nodes nearby that um, fluids drain into. And that's often the first place that a cancer might spread to.
Mm.
And if you remove the lymph nodes that contain cancer next to the organ, if there are any, that can cure the cancer too. Like maybe that's the only place that it's spread to so far. So you remove them all. But if there's lymph node involvement, if the in more number of lymph nodes that are involved, those all increase the likelihood that the cancer is going to come back some days. There's the way cancers appear under the microscope that can
Mhm.
help tell us. And then more recently, actually, it's kind of exploded since I've stopped practicing. We find most cancers have certain mutations where certain proteins that have something to do with how cells grow and divide normally.
Mhm.
Um, and these proteins are part of what is causing the cancer, because maybe the mutation is causing this protein that says to a cell grow to be constantly turned on instead of having the ability to turn on or off.
Okay.
Um, or maybe there's a protein that says stop growing, and that gets mutated so it never says stop. And so the
Mm.
cells keep growing and things like that. So um, certain cancers, you can have a good sense of how likely they are to recur based on what kind of a mutation, what protein is being overproduced or abnormally produced.
Wow. And each type of cancer kind of performs differently, correct?
We've thought that
Okay.
we've typically thought about cancer from an organ-based mindset. You
Mhm.
know, it's breast cancer or lung cancer or colon cancer or prostate cancer. As we're learning about these these mutations and these proteins that get uh, impacted and seem to be driving the cancer, we're learning that there are certain mutations that happen in cancers arising in different parts from different organs. So,
Mm.
a lung cancer that overexpresses a certain protein might have more in common with colon cancer or ovarian cancer that overexpresses that same protein than a lung cancer that doesn't express that protein. Especially since, and this all has happened really since I stopped practicing, but there's a class of medications called like targeted treatments
Mhm.
where they're designed to specifically counteract um, one of these mutated proteins, um, either by getting our immune system to recognize cells that have that mutated protein, or just it's a chemical that blocks the effect of that protein. So
Mm.
even though the cancer's producing the protein doesn't work like it's supposed to. So anyway, these targeted treatments might be useful for cancers of any origin that express that particular mutation.
Is it based off? I know some cancers is about the stages. So, like when my dad with protein, they were like, don't think of it as the stage. But when it comes to the targeted approach, would it depend on the stage or the growth of the cancer?
Well, right now, they're mostly being used for people with advanced cancers, advanced
Oh.
meaning
Okay.
meaning metastatic. I don't think
Mhm.
they've
Mhm.
moved upstream for the most part yet, um, but um, but I'm sure that's being studied. Like some patients who, like, let's take breast cancer as an example, a very common cancer. A woman might be found to have a breast cancer that is an inch or two in size in the breast, and when the surgeon looks at the lymph nodes under the arm, which is often the first place that a breast cancer might spread to, she might have several that show, at least microscopically, some evidence of cancer. So
Okay.
that's stage two. And um, she might have 60, 70% chance of being cured just from the surgery or surgery plus radiation if she's had a lumpectomy. But that means maybe a 30, 40% chance that she hasn't been cured. So many patients who present with diseases in a stage like that are offered medical treatment, which we call adjuvant treatment. Adjuvant means like additional kind of
Okay.
preventative treatment where we're saying, well, there's at least enough of a chance that there might be microscopic cells. You know, you might be, oops, the line, sorry, trying to get
Yeah,
it up
come
again.
closer to your face, I think.
Okay.
Did it's not doing it
There,
this time. We can't get
okay.
it.
Sorry. Anyway, but just under the threshold
Mhm.
of being able to detect it, as opposed to down to zero. So if you're right under the threshold, you need more treatment. And we
Right.
don't know which one you are, but let's give the additional treatment and it'll help the people that needed it, hopefully, and the people who didn't need it um, will deal with the side effects,
Mhm.
and that's a shame. But that's what adjuvant treatment is about. So now I think some of those targeted treatments are being used in that way as well.
Okay.
Um, and then there are a couple of diseases, not many, but a couple of diseases where the targeted treatments are so good that they've become the standard of care.
Mm.
Like there's a form of leukemia that was the first disease for which one of these targeted treatments was identified. This is a disease, well, leukemia is a cancer of blood cells
Mhm.
where your body produces too many of a certain type of blood cell, usually white blood cells. Um, so there's a disease called chronic myeloid leukemia, CML, where slowly but steadily too many of uh, a variety of types of white blood cells get produced. And when I was learning to be an oncologist, that was a uniformly fatal disease,
Mm.
typically on average in 3 to 4 years. And 20% of people with the disease died every year. So there were a few people that would still be alive 8, 9, 10 years after diagnosis, but they weren't cured. They just were, the medications that we had in those days were suppressing the disease,
Mhm.
containing it, but not getting rid of it. Um, and CML is produced by a mutation that creates something called the Philadelphia chromosome. Called that
Mm.
because it was discovered at the Wistar Institute next to the University of Pennsylvania
Oh,
here in
okay.
Philadelphia back in the 50s or 60s. So anyway, this Philadelphia chromosome causes white blood cells to grow and divide and not listen to signals that say stop.
Mm.
So some smart guy developed a medication that basically blocked what the Philadelphia chromosome produced.
Mm.
Um, and some people with CML who take the medicine that came from that discovery never have the disease show up again. They take it the rest of their life, but the disease never becomes a problem for them. So it took a uniformly fatal illness and
Mm-hmm.
for most people turned it into a chronic disease that as long as you take this pill, you'll be okay.
Okay.
Yeah, so it's
That's interesting.
pretty amazing story.
Right, right. So, like, so for my family in particular, on my father's side, we have a lot of cancer in the, I think between my grandfather and of course my brother and my father, all throughout that generation, it is so much cancer. Like I even keep a log of it just so I would know personally what is in my family. For when my brother had pancreatic cancer, I was tested to see if, I had anything in my DNA that would put me more at risk. But
Mhm.
most of the time, it's only they were really focused on breast cancer, and then they were telling me like my nephew would well yeah my nephew being my brother's son, he would be a better candidate. But at the time I he lives in South Carolina, so it's hard for me to push him to go get the test. But I was wondering if it was like hereditary. So this is the list of cancers, unfortunately, in my family. We've had lung cancer, breast cancer, a type of brain cancer that I'm not sure of, but colon cancer, pancreatic cancer, bladder cancer, stomach cancer, uterus, leukemia, yeah, and then that's it, and prostate. So we got a lot, and all of them, except for one, is on my dad's side of the family.
Mhm. So so yes, there certainly are genetic predispositions.
Mm-hmm.
And for certain types of genetic predispositions that are pretty rare, but it's almost guaranteed that the person will get a cancer at some point in their life,
Mm-hmm.
at least one cancer. Um, More common, it is like an increased likelihood. So, so here's one way it was explained to me that was helpful to me.
Mm-hmm.
Um, Imagine that one mutation is in a cell isn't enough to make it a cancer, that
Okay.
actually you need two mutations. And the likelihood of even one cancer causing mutation happening is really rare. Let's say one in a million. Okay.
Mm-hmm.
So, so then what's the likelihood that that would happen twice within the same cell? That would be one in a million times one in a million. It's like one in a trillion or something,
Right.
a really tiny number, which is why most of us don't get cancer, even
Mm-hmm.
though it's a really common disease. So in these di- conditions that predispose people to cancer, you wind up inheriting one mutation already.
Mm-hmm.
And typically it's an organ based um, way that this shows itself. So, like for people, mostly women who have one of the breast cancer gene mutations,
Mm-hmm.
every cell in both of their breasts has that mutation.
Mm.
Okay. So instead of it now being a 1 in a trillion risk of two happening in um, in a single cell, you've already got one of those 1 in a million that's happened, that's been inherited. So
Right.
now all it takes is one mutation to make it a cancer, which, 1 in a million is a lot more likely than 1 in a trillion. And so that's
Right.
why
Right.
and there between both breasts, there's a lot of cells. So that's why it makes the likelihood that over the course of a woman's life, she would likely get it that that high if she's got that kind of a mutation. So there
Mm-hmm.
are there are a lot of conditions, and we keep learning about different types of mutation that we didn't know about before that predispose. And
Mm-hmm.
sometimes you'll find a cluster in a family like yours where maybe they say, we don't have a name to put on this. There hasn't been anything identified. That could all be just chance that,
Mm-hmm.
you know, cancer's common enough. Every now and then in a family, you'll see a lot of people who've had cancer just by chance. It
Right.
could be you start thinking environmental,
Mm.
maybe stuff in the air. It could be certain behaviors. Are there um, you know, people who grow up in a family of smokers are more likely to be smokers themselves.
Right.
So,
Right.
and many cancers are associated with smoking. So that could be part of it too. And it could be we just haven't discovered what the genetic abnormality underlying certain clusters are. So it's something that we need to be smarter, have better ability to detect causes that ultimately lead us to figure out what's going on. So,
Yeah, I am very overly cautious when it comes to myself, and I try to encourage our next generation to be overly cautious when putting yourself in danger of doing things that could produce make you more susceptible of getting cancer. Like, just I can't control them. They do what they want to do. But I'm always in their ear. I'm always telling them, cancer runs in our family pretty strong, so you want to be careful what you do. Like, because even the things that I listed, there's multiple people for some things. Like, it's not just one person. There's
mhm.
multiple people in our family that had the exact same thing, and it definitely is for me something that I consider, and I think is more so because I worked in healthcare. I remember the one and only time I've ever saw you upset, and you were arguing with an insurance company, advocating for your patient to get a certain medication. And I'll never forget that because I've never seen you with a disposition more than what you have now. And Wendy was working there at that time, and she came out, her office was like, I was like, I know. And like just your passion, and I'll never forget that. And it even has made me aware that when it comes to these insurance companies, that they try to take control over your health, that you have to fight them and not just let them say yes or no. Like, you got to push back. And I just remember that always, like, you that made me feel, and I remember you talking about it afterwards, of how passionate you were for your patients and that you would do whatever it took. And I know in that field you have to be that way. You have to have so much compassion and fight for your patients, because it is truly life and death. It's like it's cancer is just is mind blowing to me, and that's why I wanted to talk about it because it hits so many people more than you really know because some people, especially in our community, African Americans, we like to be hush hush, don't tell nobody and all of that. But I'm that's why I keep a record of all everything I can find out about my our medical line. I keep a log of it, and like even my nephew not too long ago was like, Kim, do anybody in our family have such and such? Let me check. Because I think it's important because that the more you are aware, the more that you can eat right because you know that this is something that I mean, some things they say aren't um, genetically disposed, but I think when you know better, you do better.
Yep. Yep. So, I mean, you're bringing up great points. It's like you said, we can't control certain things that happen in our body, and
Mm-hmm.
it's sad but true, I think, to realize that much of cancer is bad luck.
Mm.
That people did nothing to cause it and probably may not have been able to do anything to prevent it.
Right.
Um, but whatever you can do to minimize your chance of the bad luck happening, particularly when it's relatively easy stuff to do, then I think, especially when you're in a family with so much cancer like yours, it just makes sense. So, anybody in your family watching this who smokes, stop. That's just like the biggest thing that increases a person's risk
Hello.
that can be controlled. Um, there's certain foods that seem to have maybe a little bit of protective effect that are good for us anyway, like fruits and vegetables that are high in antioxidants, green
Mm.
vegetables, and like colorful fruits and vegetables, and certain foods that seem to increase a risk, especially like highly processed meats,
Mm.
like certain cold cuts and um, sausage and foods that a lot of people like, but they're just not good for us. Salami and pepperoni and those kind of meats, and alcohol
Mm.
probably has a role too, um, and it like multiplies the risk that other um, carcinogens, things that increase a person's risk, play, particularly like smoking and
Mm-hmm.
alcohol together, dramatically increase the risk of a variety of cancers. So, and then there's screening. Most
Right.
cancers we don't have great screening
Mm-hmm.
tests for yet, but the ones that we do, um, we need to follow the guidelines. And for certain cancers, if you seem to be in a family where where it's showing up more than just by chance, then starting screening at a younger age than is
Mm-hmm.
recommended for the general population is often recommended.
Yeah, I started having a colonoscopy early because of that. And like, and my father, he normally had a lot of polyps, which I know is the major play. And I had actually one polyp that was precancerous.
Mm.
So I was like, okay, so yeah, we're going to stay on this 5 year.
Yeah, that's exactly why the screening is done,
Mm-hmm.
right? It because colon cancer seems to be a slowly developing cancer in most
Right.
people. And when it's caught, when it at the stage where it's still a precancerous polyp, it's got no ability to do anything harmful.
Mm-hmm.
Um, and removing it takes care of it. It'll,
Exactly.
that particular group of cells will never be a problem for you.
No. And I'm on it.
That's great.
I am very much on it. And it's because of my family history. So it's not a I don't forget about a mammogram. I don't forget about a colonoscopy. Yep. Let's do these things because I know what my family looks like. So, and then I know like for all of my family, it's not like they weren't. It just luck of the draw. And it's like you said, sometimes it's there and you just don't know until it hits that threshold.
Hmm.
So I definitely appreciate the knowledge. I could talk to you forever, but I won't take up your time. I promised that hour and I won't invade that. But it was definitely good information that you shared, just learning and sharing about cancer. I mean, that was an eye opener. As much as we've talked, I don't recall the threshold part. That one was new for me, but that was wow. Like it makes sense now. It really does when it comes to a person, especially when they've already been identified with cancer, and then next thing you know, they go back for a checkup and the cancer is there, although they thought it was gone.
Hmm.
So it kind of makes sense. But tell the people about how they can connect with you and also your new endeavors.
So, so I'm no longer doing anything clinical in medicine, and I've made this stage of my career about supporting actually docs who are, um, particularly those who are trying to make something happen on behalf of their patients, on behalf of their practice, on behalf of their organization, their community, and um, don't really know how to get started or just would like some help achieving their vision. So I become a coach that helps docs like that, as well as docs that may be in the early stages of burning out, which is
Mm.
a big problem in medicine too. So anyway, I'd be happy to talk about that at a later date. And
Definitely,
yeah,
definitely, because
yeah.
I've one thing that I had a conversation with one physician about the great retirement or the great shift when it comes to clinical personnel because of COVID had drained so much out of them. And that I have a few clinical friends who say it's definitely harder. Like I've even a lot of good people I know have retired or changed careers because they couldn't do it. They made it through, is what they say, and they just can't go on. So I think having someone like yourself to help them, and I can personally say that you are an excellent coach. I was one of your startups,
Yeah, I
and
was just cutting my teeth then, but yeah,
yes, I know. I can't even
yeah.
imagine what you're doing now. And
No,
you were awesome.
it's
Like
a
we
lot.
had some great sessions.
It's different, and my focus now, just to wet the whistle, if we talk again about this here, my focus is on helping people become more mentally fit. And
Mm,
we define that as being able to face the challenges in our lives using a positive mindset rather than what most of us do, which is use a negative mindset. Um, so instead of looking at circumstances in our lives, even as horrible as the worst of the pandemic,
mhm,
as oh, this is bad, bad, bad. Um, how can you flip that and say, how could I possibly turn this into a gift or an
mm.
opportunity? And that's what people who've got good mental fitness have the ability to do. So anyway, we can talk next time.
Definitely.
Okay.
Definitely. I would definitely want you to, because that's a very important focus. So we can definitely look at our calendars and try to get you back for that. So I definitely appreciate everything you shared tonight. I want to tell people they have to check this out. Cancer in the community and in our life, it's not like it's not there, and we need to be educated on what it is and what our loved ones are going through, or even what you're going through, so that you would be mindful of what you can do to increase your odds in defeating it or not even getting it. So that was a great pinpoint. So everyone, thank you so much for chiming, looking in. And I know a lot of times a lot of people don't look when I'm live, but they do come back and watch after the fact. So make sure you share this video with your family and friends, because to not be fearful. They need to be knowledgeable about what cancer is and what their loved ones are going through. So until next time, as you know, I'm here every Monday night at 7 p.m. Eastern Standard Time. So until next time, I'll see you next week. Bye.